Let me talk to you about something nobody likes to talk about, but almost everyone going through cancer experiences: constipation. Yes, the thing that makes you uncomfortable, bloated, irritable, and sometimes miserable. And here is the truth: constipation during cancer treatment is common, predictable, and preventable, but it is often ignored. Today, I want to explain why it happens, why it matters, and most importantly, how to manage it properly. Let's talk openly, because suffering in silence is unnecessary. I am Dr. Pachipala, who is board certified in hematology and oncology, and I practice in the greater Houston area. What is constipation really? Most people think constipation means not going every day. That's not correct. Constipation means hard stools, straining, feeling incomplete evacuation, going less often than your normal, or feeling blocked. You can go daily and still be constipated. In cancer patients, constipation affects 30 to 60% or more, and if you're on opioid pain medication, the number is even higher. Why does constipation happen in cancer? Let's simplify this. There are four major causes. Number one, pain medication, especially opioids such as morphine, oxycodone, hydromorphone. These drugs are excellent for pain control, but they also slow down the movement of the intestine. So stool stays in the colon longer and more water gets absorbed, and the stool becomes hard and difficult to pass. This is called opioid-induced constipation, and unlike other side effects of opioids, the body never develops tolerance to this problem, which means constipation often gets worse over time unless treated properly. Number two, chemotherapy and other treatments. Some chemo drugs slow bowel movement. Anti-nausea medications that we use with chemo can cause constipation as a side effect. Dehydration can worsen constipation. Number three, reduced physical movement. When you're tired, weak, or hospitalized, your gut becomes lazy too. The intestine loses movement. When you don't move, your bowels don't move. Number four, cancer itself. Tumors pressing on the bowel, electrolyte imbalances, poor appetite, low fluid intake, and rarely bowel obstruction can lead to constipation. So what's happening here? We have a cancer patient and they have multiple factors impacting them, such as pain medications, such as opioids, chemotherapy, reduced physical activity, dehydration, poor appetite, tumor pressing on the intestines, metabolic abnormalities. All this can impact and cause constipation. So why is constipation not a small issue? So many patients think, oh, it's just constipation, I will deal with it. Constipation can potentially delay cancer treatment, reduce pain medication use because the patients skip pain medication, worsen quality of life dramatically. Let me say this clearly: uncontrolled constipation can become a medical emergency. So what are the warning signs of medical emergency? These are real red flags. If you have severe abdominal pain, vomiting, fecal impaction, bowel obstruction, emergency room visits, even bowel perforation in extreme cases. So how do we prevent constipation? Very important. If you remember one thing from this video, if you start opioids for pain, start a bowel regimen the same day. Not after 5 days, not after 1 week, the same day. So here is a simple management plan. Step one, lifestyle modification, which is the foundation of managing constipation. Drink fluids if allowed medically. Gentle walking daily. Respond to urge to defecate, don't delay. People do not squat these days to defecate. Squatting helps straighten the rectum to help expel the stool naturally. Using a footstool under the feet while sitting may help straighten the rectum. But listen, lifestyle alone is usually not enough in cancer patients on opioids. So that brings to step two, which is the medication use. First line medications. Most people end up needing this medication. There are three types of medication. One is stool softeners, such as Docosate, which soften the stool. Number two, osmotic laxatives, which essentially bring water into the colon to soften the stool. They include polyethylene glycol, which is Meralang, lactulose. They pull water into the bowel and soften the stool. Number three, stimulant laxatives such as Senokot, Besocordyl, stimulate bowels and cause bowel movement. Most patients need combination of different types of constipation medication. The goal is soft formed bowel movement every 1 to 2 days without straining. Step 3, if you are still constipated, especially with opioid medication, we use special medications called methyl naltrexone, naldemidine, naloxegol. These medications specifically block opioid effects on the gut without affecting pain control, and they can work rapidly. Step 4, this is for severe constipation. You tried everything, but is still constipated, impacted. In that situation, we need suppositories, enemas, manual disimpaction, not present but necessary sometimes. I have done one in the past. In conclusion, let me leave you with one important message. Constipation in cancer patients is very common, but it is also very manageable. With early prevention, proper medication, and good communication with your physician or healthcare team, most patients can avoid serious complications. If you or someone you love is undergoing cancer treatment and struggling with constipation, please bring it up with your doctor, because something that seems small can make a huge difference in comfort and quality of life. And in cancer care, quality of life matters just as much as treatment. If you like this video, please like, subscribe, and share with your family and friends. Thank you for watching this.